Hi everyone, thanks for tuning in today. Today I'm doing a special video with collaboration from friend and colleague Dr. James Ewan, who is a naturopathic doctor at Infinity Health Center. Together we have collaborated on different patients' care, and today we just wanted to highlight a couple of ways in which we do that on a regular basis.
So yeah, just like Dr. Galata mentioned, I'm a naturopathic doctor at Infinity Health Center. My approach really focuses on addressing the root cause of issues. I really focus on diet and nutrition as a foundation, and I also like to incorporate things like herbal medicine, nutritional supplements, as well as traditional Chinese medicine acupuncture, which I find to be also very helpful for a lot of the co-management in cases.
That's great. So we're going to highlight a couple of cases where together we've collaborated on the patient's care. The first situation is a 45-year-old woman who came to me with knee pain. She had some imaging done and there were changes of osteoarthritic nature. So the way that I implemented a protocol for her to help relieve some discomfort and strain on the knee was to thoroughly assess her biomechanics in gait and in different physical activities to see whether there were any deficits or dysfunctions in that chain. And for knee-specific training, we did strengthening. We talked about quad sets, we talked about even progressing her up to squats. Can you tell us a little bit about how you came into that care as well?
So yeah, definitely. So the patient that we both co-managed, after assessing for her diet, I noticed that the diet was really high in processed foods. There was a lot of refined carbohydrates and sugar, a little bit of alcohol consumption, and also some fried foods. And all of these are known contributing factors for low-grade inflammation. So the goal is essentially to eliminate these pro-inflammatory types of foods and substitute them with more anti-inflammatory types of foods. For example, more whole grains, less processed foods, lots of vegetables and fruit, and incorporating fatty fish, for example.
And she's doing really well last time we checked in with her.
Yeah. One thing to add as well is after the initial dietary recommendations, she had a significant improvement, especially with the rehabilitation. But another thing that we also added was curcumin. Curcumin is an ingredient that's derived from the Indian spice known as turmeric. And curcumin has really good anti-inflammatory effects. In fact, it's been shown in studies to be comparable to certain NSAID drugs. Now, the issue with curcumin, however, is that it can't interact with other medications, so it's important to talk to your naturopathic doctor or healthcare provider to make sure that it's safe to take.
Next, I want to highlight a case for cervicogenic headaches as well as menstrual PMS type headaches. So this young lady had seen me a couple of weeks ago and she was complaining of neck and upper back pain. She's a flight attendant. And upon a thorough assessment, we found that there were some restrictions in her neck, upper back, and a lot of it was postural, repetitive strains and sprains because there was quite an insidious onset to her pain. She confided in me that she also would experience at the beginning and at the end of her menstrual cycle headaches. And for these cervicogenic type headaches, which I treated her for, we implemented adjustments, acupuncture, mobilization, soft tissue therapies, that type of treatment, as well as education and advice on repetitive strain activities and postural type of discomforts. And I also brought in Dr. Ewan to help co-manage her with her more PMS type related dysfunctions. Can you tell us a little bit about that as well?
Yeah, so definitely. So when it comes to anything that's typically revolving around the PMS and your menses, there's changes in hormonal imbalances, like, for example, you can have a drop in estrogen and progesterone. So it's always important just to get something like a saliva hormone test to really figure out what sort of balances might exist. But once that's identified, we can incorporate natural herbal remedies. For example, chaste tree or chaste tree berry is a very good one that is known to help with PMS as well as irregular periods and premenstrual headaches, as an example. But also, again, assessing for the general lifestyle and diet, seeing if there's other factors that might be, for example, contributing to excess estrogen in the body, And those are all things that we look to address to eventually, once we clean that all out, then we see improvements in the symptoms and the chronicity and severity of these premenstrual headaches and symptoms.
And what kind of time frame would you be looking at in terms of wanting to see some change or recovery from those types of symptoms?
It's a great question. Typically, what we notice is that usually after supplementing for about 2 to 3 months is when we notice some more changes. So, especially after the first cycle, because definitely when someone supplements right before their cycle, we probably wouldn't see much change. But by the second or third cycle, that's when we start to see more significant changes and improvements.
We'll be tracking her progress along. She has a little bit of an erratic schedule at times because as a flight attendant, they're in and out of the country so frequently that we'll be able to give you a more conclusive update in the next couple of months. Lastly, I also wanted to highlight a case where a young gentleman had been experiencing low back pain. And in his situation, after I assessed and looked at a couple of different functional types of protocols for him, we again found some repetitive strain type of injuries to his low back. He is involved with shift work, and so his sleep is quite erratic and it's irregular. And we know that in sleep, healing actually happens, and that's the time that it happens the best at. So when you have an erratic or irregular sleep schedule, it's actually harder to begin to notice those changes in healing and to kind of have relief from pain and notice whether something is quote unquote working well or not. In this situation, James, can you tell us a little bit about what kind of approach you would take to help someone's sleep symptoms if they were having a little bit of deficit in that regard?
Yeah. So one of the most common things I see in patients that have issues with sleep when it comes to shift work is they also tend to be pretty dependent on caffeine. And more often than not, we do realize that caffeine can be sometimes too overstimulating, that it can also affect their sleep at bedtime. Now, the issue with shift workers is because of the erratic schedule, they don't have a consistent time that they can rely on. So one of the things that I like to incorporate is melatonin. And melatonin is a hormone that helps with your sleep-wake cycle. So it helps your body get ready for a more restful sleep, essentially, and it helps with regulating our circadian rhythm. And it's very important to take, especially for shift workers, because again, if you're always sleeping erratically, your body's not producing as much melatonin, and as a result, your sleep isn't as regular, it's not as restful. So melatonin would definitely be one of the things I would consider on the top of my list to use for a shift worker. But again, it's always important just to make sure that other medications and if they're taking other supplements, that they don't interact as well.
Hope you found this video helpful in terms of getting an idea of how, as a chiropractor and a naturopathic doctor, together we can collaborate on someone's care. Often in clinic, I find that we all sort of have sometimes blinders on when it comes to our own ways of practicing our specialties. And one of the best things that you can do for someone is knowing when to refer and knowing how to bring in another healthcare practitioner who can collaborate on that person's care from their targeted treatments and different types of therapies.
Definitely, and again, it's always meant to provide a holistic approach. There's not always just one best way. We always want to incorporate multiple ways to support healing and recovery. And in the end result is that we get more patients that heal faster, they recover quicker, and overall they're feeling a lot better too.
Thanks for watching.